بسم الله الرحمن الرحيم. هتكلم على دايا رمضان study, glycoside MR, and this is the latest practical guidelines, diabetes and Ramadan, talking about sulfonylurea. And sulfonylurea is widely used, and there is wealth of evidence about sulfonylurea. كلنا استخدمناها سنين طويلة جدا with good experience, and they prove to be efficacious. However, there is risk varying across medications within this class. يعني sulfonylurea effective لكن احنا عارفين انها بتعمل hypoglycemia في بعض الأحيان. طبعا مش كلهم الحقيقة بيعملوا hypoglycemia، وفي different incidence of hypoglycemia due to different receptor interaction, binding affinity and duration of action. Glycoside MR is known to be effective together with less incidence of hypoglycemia. كلنا جربنا glycoside MR وعارفين ان هو less incidence of hypoglycemia, even comparable to some non-hypoglycemic medications, ويمكن ده اللي هنشوفه ونشوف evidence عليه. The use of older drugs within this class like glipenclamide طبعا should be avoided during Ramadan على قد ما نقدر. Even الستاديز قالت حتى لما بنقلل الدوز بتاعت الجلايبنكلاميد برضه بيحصل هايبوغلايسيميا للبيشنتس during Ramadan. Should be avoided during Ramadan according to DAR guidelines 2021. Studies اتعملت in India and Malaysia comparing sulfonylurea with DPP-4 inhibitors, and they found that glycoside MR has least hypoglycemic events comparable to DPP-4 inhibitors. وبالتالي ده طبعا proving the safety of glycoside and glycoside MR, especially during fasting hours. No significant difference between glycoside MR and DPP-4 inhibitors as regards hypoglycemia. Then glycoside MR offers a balance between good control and safety. This is a new meta-analysis done on 33,000 patients using different oral anti-diabetic medications, showed that glycoside MR was the most potent of them, reducing hemoglobin A1C 1.3% compared to all other oral anti-diabetic medications. In advanced trial, 70% of the patients used glycoside MR 120 milligram per day, and 81% of these patients reached the target hemoglobin A1C of less than 7%, and the hemoglobin A1C was reduced in the group اللي كانت الهيموجلوبين A1C بتاعتهم اكتر من 11. يمكن ده احنا عارفينه في كل الاذر ميديكيشنز ان كل ما زاد الهيموجلوبين A1C كل ما زاد الافكتفنس اوف ريدكشن اوف هيموجلوبين A1C، ولكن ده مايكرون MR او الجلايكوزايد MR reduced the hemoglobin A1C 4.3%. يمكن ده كان من الارقام العاليه جدا. Glycoside offers control with doubling the dose, causes double the efficacy. يعني one tablet of 60 milligram MR reduce the fasting plasma glucose 66 milligram, while 2 tablets 120 milligram glycoside MR reduce the fasting 106 milligram. In advanced trial with 70% of the patients used glycoside MR 120 per day, 120 milligram per day, the incidence of hypoglycemia was minimal, and only 0.7% showed cases of severe hypoglycemia. In regards to hypoglycemia, glycoside MR is more similar to metformin, and this meta-analysis was done on 130,000 حالة used different sulfonylurea together with metformin. زي ما احنا شايفين هنا ان glycoside MR was comparable to metformin as regards incidence of hypoglycemia, وكل ال other sulfonylureas كانت ليهم more incidence of hypoglycemia. Glycoside according to DAR studies have the lowest risk of hypoglycemia. This study was done on 1,066 patients during Ramadan, and it proved that glycoside was safe as DPP-4 as regards hypoglycemia. واحنا شايفين هنا يمكن كان الجلايبنكلاميد كان ال incidence of hypoglycemia 19%, followed by glimepiride 12%, followed by DPP-4 inhibitor 6.7%, and glycoside MR 6.6%. يعني تقريبا زي DPP-4 inhibitors. This is a new evidence on glycoside MR in Ramadan, the DIA Ramadan study. It is an international real-world study assessing safety and effectiveness of glycoside MR60 during fasting. The rationale of this trial, sulfonylurea, are known to be effective, but they may cause hypoglycemia. احنا كلنا عارفين هذا الكلام. And also weight gain. يعني احنا بنستحمل طبعا ان هم effective وبيدونا effect كويس جدا مع البيشنتس، لكن في نفس الوقت عارفين ان هم ممكن يعملوا hypoglycemia وممكن كمان يعملوا weight gain. ولكن هنا في differences في نفس الجروب ده في molecules مختلفة عن molecules. Difference due to different receptor interaction, due to binding affinity, different binding affinity and duration of action. Glycoside is well known among the sulfonylurea group to have lower risk of hypoglycemia even during the period of Ramadan fasting, fasting hours. Again, the new formulation of glycoside, the modified release, allows progressive release of the drug in once daily dose. يعني العيان بياخده مرة واحدة ولكن بيبقى فيه modified release تقريبا على مدار اليوم with lower risk of hypoglycemia compared to other sulfonylurea. طبعا during Ramadan في complete change في التايمينج of the meals وفي الفاستنج hours. البيشنت بدل ما هو بياكل فطار وغدا وعشاء، هو الميلز بتاعته اتحولت الى فطار at sunset وبعدين بعد كده سحور. طيب ده كان البيزس of the DIA Ramadan trial. This is the study design and population. The aim of the study was to explore safety and effectiveness of glycoside MR in patients planning to fast during Ramadan in a real-world setting. In different regions of the world كان في بلاد كتير مشاركة. Inclusion criteria: type 2 diabetic patient with controlled or suboptimal controlled hemoglobin A1C treated with breakable glycoside MR. At least البيشنت بيكون اخد الجلايكوزايد MR 3 months before the onset of the trial. بيعمل SMBG، بياخد دايري بيكتب فيها. And those patients were willing to fast during Ramadan. يعني ده كان لازم يكون العيان بينوي الصيام. كان في visit zero دي قبل رمضان ب 6 to 8 weeks. بعد كده الرمضان duration 4.5 weeks 4 أسابيع ونص. post Ramadan period 4 to 6 weeks. زي ما قلنا البيشنت بيعمل دايري بيقيس فيها البلاد جلوكوز بتاعه وبتبقى collected and it is a real world prospective international multi-center study. patients had hemoglobin A1C less than 9% في الأول، وزي ما قلنا بيستخدموا glycoside breakable MR60 بديفرنت دوزز، هنعرف الدوزز دلوقتي. primary endpoint proportion of patients with at least one symptomatic hypoglycemic event documented or not by measuring SMBG وكان concentration less than 3.9 millimole يعني تقريبا اللي هو 70 milligram per deciliter. And the secondary endpoint change in hemoglobin A1C, change in fasting plasma glucose, weight change between visit 0 and visit 1. The proportion of patients with one or more confirmed hypoglycemic event or one or more severe hypoglycemic event. Number of patients by region and by country, total number of patients 1,214 patients in 9 countries. طبعا among them Egypt كان فيها 14% of the cases. Those were the baseline characteristics of the patient. In mean age 54, in mean disease duration 5 years, mean hemoglobin A1C 7.5. A number of anti-diabetic medications can في patients على glycoside MR alone can 40% of the cases, glycoside MR plus 1 oral 29 أو 30% of the cases, and glycoside MR plus 2 oral اللي هو كان 30% of the cases. وده كان a number of anti-diabetic medications type of anti-diabetic medications at baseline زي ما قلنا 40% أو 41% كانوا بياخدوا glycoside MR بس. بعد كده في glycoside MR plus metformin, glycoside MR plus DPP4 plus others وهكذا. الباقي كلهم كانوا البرسنتج بتاعتهم قليلة. 95% of the patients were on glycoside MR 60 to 120 milligram. The reported hypoglycemic events زي ما احنا شايفين those were the symptomatic hypoglycemia before Ramadan occurred in 0.2%, 2 cases only out of more than 1,000 cases. During Ramadan 2.2% symptomatic hypoglycemia, post Ramadan 0.3%. Then low rate of symptomatic hypoglycemia out of Ramadan period. Confirmed hypoglycemia pre-Ramadan 0.2%, during Ramadan 1.6%, post-Ramadan 0.1%, and patients with at least one severe hypoglycemia 0% before Ramadan, 0% during Ramadan, and 0% after Ramadan. الإفكت على الهيموجلوبين A1C والفاستنج بلازما جلوكوز والويت جين بالنسبة للهيموجلوبين A1C حصل reduction of minus 0.3% hemoglobin A1C reduction between visit 0 and visit 1. بالنسبة للchange in fasting plasma glucose 10 milligram reduction in the fasting between visit 0 and visit 1. بالنسبة للweight كان في 500 grams weight reduction between visit 0 and visit 1. The conclusion, these are the conclusion كلهم. 2.2 symptomatic hypoglycemia, 1.6 confirmed hypoglycemia, 0.3% hemoglobin A1C. Let me remind you, 0 severe hypoglycemia, fasting plasma glucose 10 milligram per deciliter, and weight reduction 500 grams weight reduction. There was no dose adjustment during Ramadan، ودي نقطة مهمة قوي لأن أغلبنا بيقلل الميديكيشن مع بداية رمضان، لكن في الداية رمضان trial they fasted safely without dose reduction. ليه بقى نو هايبوجلايسيميا؟ يعني ده اللي احنا يعني بنحاول نفهمه مع بعض. اول حاجه ان طبعا سلفونايل يورياز كلهم مش زي بعض. بالنسبه للجلايكلازايد ليه early peak of action، لكن بقيه السلفونايل يوريا ليها blunted peak او delayed peak، والاريا under the cover with انسولين سكريشن هنبص نلاقيها اكتر في الاذر سلفونايل يوريز عن الجلايكلازايد. ده الحقيقه الكيرف بيفرق بين الجلايكلازايد والجلايبنكلاميد. السبب الثاني ان الجلايكلازايد ليه 1 ريسبتور سايت بيمسك في ريسبتور واحد، while الاذر سلفونايل يوريا ليه 2 ريسبتورز بايندينج سايتس، عشان كده بيمسكوا جامد وبيبقى في slow reversibility with the other sulfonyl ureas, while in glycoside it is easy to be reversible action. Again, the active metabolites, the glycoside ملوش active metabolite, while other سلفونايل يوريا زي جلايبنكلاميد او جليميبرايد ليه active metabolite. دي الموديفايد اكشن اوف جلايكلازايد زي ما احنا شايفين. لو البيشنت اخدها مع الافطار بتشتغل على الافطار، بتشتغل على السحور وان بتوين سناك لو البيشنت اكل في النص، ولكن هنبص نلاقي الاكشن بعد كده بتبتدي تقل، وده بيبقى ماشي مع الفاستنج تايم او الفاستنج اورز اوف رمضان. In conclusion, after metformin, sulfonyl urea are the most effective and cost-effective additional second line of treatment, and glycoside MR is highly effective in reduction of hemoglobin A1C, reaching 4.3% reduction in hemoglobin A1C. Glycoside is the least sulfonyl urea to induce hypoglycemia, and the Diet Ramadan study showed safety and effectiveness of glycoside MR without any dose adjustment in patients wishing to fast Ramadan. No dose adjustment was done, and the dose to be given with iftar. Thank you very much.